Hello everyone, my name is Vaishnavi Mahadev Vallekar. Today is a technical topic and today's topic name is the urinary system. The urinary system is also known as the renal system. The system is responsible for producing, storing and eliminating the urines. It plays a crucial role in maintaining the body fluid balance and regulates the pressures. The system helps to remove the waste products from the body and maintains the homeostasis. Then the anatomy or the structures of the urinary system. The urinary systems consist the different organs like kidney, urethra, urinary bladder. First one, kidney. The kidney, it is a bean-shaped organ located on the either side of the spine, just below the rib cages. The kidney helps to filters the bloods to remove the waste products, excessive waters, and the electrolytes. Then it produces the urines through the process like filtration, reabsorption, and the secretion. It regulates the blood body pressures. Then controls the RBC productions by releasing the erythropoietins. Then maintains the acid base and the electrolyte balance. Then the nephrons are the functional units for the kidney, and it is responsible for the filtration of the urines and the formation of the urines. Then the second one, it is a uterus. It is a thin muscular tubes that is a 10 to 12 inches long that connects the kidneys to the bladder. It transports the urines from the kidney to the bladder through the peristaltic movement. Then the urinary bladder. The urinary bladder, it is a muscular organ which is located into the pelvic cavity. The urinary bladder helps to store the urines until it's expelled out from the body. The urinary bladder can hold the 400 to the 800 liter urines into the urinary bladder. Then the muscles facilitate the bladder contractions for the urine expulsions. Then the internal urethral sphincters prevents the involuntary leakage. Then fourth one, it is a urethra. The urethra, it is a thin tube which is leading from the bladders to the external opening of the urinary system. It allows the urines to pass out from the body. Then in the males, it is longer, about the 8 inches, and also carries the semen. But into the females, it is a shorter, it about the 1.5 inches. They increase the risk of urinary tract infections into the females most of the time. Then functions of the urinary systems. First one, excretion of the waste products. The urinary system helps to eliminate the urine, urea, uric acid, and the other nitrogenous waste from the protein metabolisms. Then regulation of the fluid and the electrolyte balance. Then urinary system maintains the level of sodium, potassium, calcium, and the chlorides. Then acid base balance. The urinary system controls the pH of the bloods by excreting the hydrogen ions and reabsorbing the bicarbonates. Then fourth one, it is a blood pressure regulations. The kidney regulates the blood volumes and secrete the renin, which influence the blood pressures. Then fifth one, it is a red blood cells productions, in which the erythropoietin stimulates the production of the RBCs into the red bone marrow. Then vitamin D. Then the vitamin D activation. It converts the inactive vitamin D into the active vitamin D forms. Then the process into the urine formations. First one is a glomerular filtration. Then the second one, it is a tubular reabsorption. In the tubular reabsorption, the essential substance like glucose, amino acids, and the waters reabsorbed into the bloods. Then third one, it is a tubular secretion. Into the tubular secretion, the additional waste products and the excess ions are secreted into the tubular fluid. Then concentration of the urines. It occurs into the loop of the Henle and collecting the ducts under the influence of the antidiuretic hormones. Then the common disorders of the urinary systems like urinary tract infections, kidney stones, chronic kidney diseases, it is also known as the CKD. Then the acute kidney injury, then minor kidney injury, then the incontinence, then the polycystic kidney diseases, then kidney stone, then the diagnostic method like physical history, like history of the patients, physical test, laboratory test like urine analysis, urine cultures, different types of the blood test, then the imaging study, then the different imaging studies like ultrasound, CT scan, MRI, then the X-ray, then intravenous pyelogram, that is IVP. Then the specialized test for the urinary system diseases like urodynamic testing, renal biopsy, then the glomerular filtration rates, then the treatments for the urinary system diseases like antibiotic drugs increase the fluid level, then the different types of the surgeries, biopsy, healthy lifestyles, change into the lifestyle, then the exercise, then the phosphate binders to manage the fluid balance into the body and improve the intake of the fluid into the body and change into the lifestyle and the different medications. Thank you.